Hi friends, welcome back. I'm Elaine and I'm living with autoimmune disease, and I was just about to inject my B12, and I thought I should come on here and share with you my low B12 story and the symptoms and signs that I knew I was having a problem and how it's all tied to my autoimmune disease. And don't worry, I will spare you the gory details of actually filling the syringe and injecting it. Before we jump into this, I just want to remind you that I am just a patient. This is just my story. I am not a doctor. I have no medical training, and I'm just sharing with you my experience. I would always encourage you to speak to your doctor about your situation. I think a lot of times as autoimmune disease patients, we dismiss certain symptoms or we normalize them, or we don't discuss them with our provider because we just attribute them to the disease itself or side effects of the medication we're on. And sometimes that can get very tricky because there could be something else going on, and that's exactly what was happening for me. I will tell you my B12 deficiency was discovered about the time that I was dealing with malabsorption. If you haven't seen my story of when my small intestine died, I will link that down below for you. But that is when the B12 deficiency that I have was discovered by my primary care physician. At that time, I was deficient in a lot of things. My blood work was very messed up because I had malabsorption and I wasn't absorbing any vitamins really. They discovered it when they were looking into things. And that is when I started getting B12 injections with my doctor to treat the B12 deficiency that was in my blood. As I began medication and I became a little stronger, I started to take sublingual B12. That is the B12 that you put under your tongue. And I started to kind of treat myself that way. And it was never really an issue until I got sick with RA in 2009, and I started to have more symptoms of B12 deficiency. But even though I had B12 deficiency before, I didn't really attribute the symptoms I was having to the B12 deficiency until my rheumatologist looked into it. Some of the symptoms I was experiencing with B12 is I was getting very lightheaded, feeling like I was in a fog. Also, I noticed more like tingly feelings. Like I noticed the tingly feelings in my fingers, in my toes. Sometimes on my face, I would get like little tingly feeling. Sort of like a neuropathy, I guess. Also, brain fog. How oftentimes do we attribute brain fog and the feeling of like not being able to collect our thoughts to autoimmune disease? Now, yes, that is a symptom of autoimmune disease, especially things like fibromyalgia and a lot of other things. And it can be a side effect of our medication to not be able to think clearly. However, don't always think that that's it, because I was noticing a lot of brain fog, a lot of like forgetting words, but I would just have that brain fog feeling of not fully there, not fully cognizant. Also fatigue, very lethargic, like tired. And I'm not saying that B12 is totally the culprit for all of these things, but these are symptoms I dealt with B12. So you can see how lightheadedness, that tingly feeling, brain fog, fatigue could all really tie back to autoimmune disease. However, it is worth bringing it up to your doctor if you're experiencing these things so that they can run a simple blood test. B12 deficiency is just a blood test. It is run through the blood. It will not come up in your normal blood work that your rheumatologist or your primary care physician are pulling. It is a separate blood test alone, and you have to request it. You can ask your rheumatologist for the blood test. You can ask your primary care for the blood test. You can ask your gastroenterologist. You can ask your hematologist. Any physician who is tied to that kind of blood work can run it for you and figure out if you are B12 deficient. So you're wondering, okay, Elaine, so how is it tied to autoimmune disease? Because you're on your channel saying your autoimmune disease could be causing low B12. Well, any autoimmune disease that affects your GI tract sometimes limit the absorption of certain vitamins when your food is processing. And a lot of our autoimmune diseases affect our GI tract. So things like scleroderma, things like lupus, things like ulcerative colitis or Crohn's disease, those all affect the GI tract. And because the GI tract isn't functioning properly, sometimes your digestive tract cannot capture the B12 from your food. And did you know that there is actually a B12 deficiency that is autoimmune disease? There is a subset of low B12 that is caused because your immune system is attacking that. And we all know that autoimmune diseases like to come in pairs. So sometimes you can have that as an overlap disease. And for me, my GI tract cannot absorb the B12 that I need from my food. Now, you're wondering, how come you have to take an injection and you can't just take a pill? Well, when your GI tract is involved and you're not absorbing it from your food, to put a pill in your GI tract and have it processed through, you guessed it, your GI system, your small intestine is not going to gather the vitamin from the pill that you're taking because it's not absorbing it the other way, just in the food you're eating. I inject B12 to help my level of B12 deficiency stay normalized. And like I told you, I was taking those sublingual pills before, the ones you put under your tongue, that those are absorbed more effectively too than just taking a pill. However, I find the injections are much easier for me. When my rheumatologist realized that my B12 deficiency was really low and I had been ignoring it and not thinking, oh, you know, I could be having B12 deficiency and this is why I'm having these symptoms or side effects, my rheumatologist had me injecting B12 every week until we could get that level up. Now, I can't inject it myself. David actually does it for me because it goes in the muscle of your arm. A lot of people just go to the doctor and get these B12 injections. I just prefer to do them at home. It's easy for us. If you do not have a person at home to help you with your injections, you can certainly get this from the doctor's office. It could just be a nurse's visit or something like that. Does the B12 help me with the symptoms that I feel? It's not a fix to everything. Obviously, I have autoimmune disease. These symptoms are a part of autoimmune disease. They are part of my medication and they don't fix it all, but they do help things to get better. I notice when I can't think properly or my brain fog gets really bad and I start making sure my levels of B12 are consistently good, then I can think a little clearer. I don't have as much fatigue. Certainly the lightheadedness and that kind of thing, it does clear up when my B12 levels are good. So I'm not saying B12 is a quick fix for all your autoimmune diseases, but I just wanted to bring it to light because I think oftentimes, like I said, we dismiss our symptoms or we normalize them and we don't discuss them with our providers. We don't tell them that things are actually getting worse. It might be worth it just to ask for a B12 blood test and see if that is something that you're dealing with. If your brain fog is getting really bad and you're forgetting things, why not get a blood test and see if maybe it's something that can be improved. And remember, friends, it's okay to ask about this blood test. It doesn't make you a hypochondriac or make you overthinking your autoimmune disease. It's a good conversation to have with your doctor. And you can just preface it with like saying, I heard that autoimmune disease can affect your B12 levels. What do you think about that? Do you think it's worth having a blood test done to see what my B12 level is? Do you think that might improve some of my symptoms? It's hard to advocate for yourself, but it doesn't make you a hypochondriac for knowing this information. I wonder how many of you have low B12 as well. If you do, leave me a comment down below. Let me know. I am curious because I know it is a big thing in our autoimmune disease world that a lot of people have this deficiency. So I'm curious, and especially if you have GI issues, I know you probably have encountered this, so let me know. If you found this helpful and maybe you didn't know that low B12 can be linked to autoimmune disease and this was helpful for you and maybe you're gonna discuss it with your doctor or maybe ask about it, give me a thumbs up on this video. If you like this kind of video of me sharing what I have or like how I manage it, give me a thumbs up too. It's helpful for me when I see other people's experiences, so hopefully this helped you. Thank you for watching. Thank you for being here. If you'd like to come along on my adventure, I would love to have you. Please hit the subscribe button. My adventure is sometimes fun, it is sometimes medical, but it is always an adventure. It's absolutely free to subscribe. It just keeps you in the loop when I upload things. My upload schedule is sometimes off because, well, I'm an autoimmune disease patient, Sometimes I can film videos and be here, and sometimes I am resting on the couch or in bed because I feel miserable because I'm a patient. But if you subscribe, you'll be notified when I upload. All right, David and I are off to go inject my B12. If you're injecting B12, remember when you pull the little cap off to wipe it with alcohol before you fill your syringe. I'm reminding you that because I didn't really know that until somebody told me. My pharmacist forgot to tell me that. So maybe I'll pass that along to you. But we're gonna go inject. Thank you for watching. Until my next adventure, go have yours.